Welcome to Dare to Discuss, the podcast exploring medicine's untold stories. In each episode, we are joined by someone sharing their lived experiences and an expert in the field to share their insights from a medical perspective.
On today's episode, we will be discussing struggles with fertility and miscarriage. And if those are subjects that are too difficult for you right now, we understand and hope you'll join us next time.
Welcome to this episode of the Dare to Discuss podcast, in which we will discuss reproductive challenges. My name is Linda and I'm very honored to be joined by Nicole, who will share her personal insights and experiences with us. Thank you so much for joining us.
Thank you very much for having me.
So let's start off, and I kind of want to go back to where everything started for you. And I would like to ask you if you could tell us about how you found out that you had challenges conceiving.
Yes, so when I was about 19 or 20, I was diagnosed with polycystic ovarian syndrome, which is where you ovulate less frequently. So from that point, I kind of knew that conceiving when I wanted to have children wouldn't be straightforward. And then, so when we actually did start trying, my GP referred me to a fertility clinic fairly quickly, because if you're not ovulating frequently, you're not going to conceive very easily. And then after that happened, and I unfortunately started to have a few miscarriages, other things came to light about my fertility.
Thanks so much for sharing that with us. So what underlying medical conditions do you have that are affecting your fertility, and how was the process of finding that out?
So I've already mentioned about the polycystic ovarian syndrome. I was diagnosed by going to my doctor with that, and I was referred for a scan, and the scan just shows that you have cysts on your ovaries, and of course that's naturally going to affect fertility. I also, when I did start trying to conceive, learnt that I had high factor VIII, which unfortunately led to me having a couple of miscarriages. And this is a condition that makes your blood quite sticky. And again, so that was discovered because as a result of being investigated for miscarriages. I also, a little bit later down the line, was diagnosed with ulcerative colitis, which is a type of inflammatory bowel syndrome, which causes inflammation in the body. And unfortunately, that affects fertility as well.
Factor VIII, it's something. Is it quite uncommon? I haven't heard of it frequently.
I mean, I hadn't heard of it. It was after my second miscarriage. Because of the PCOS, I was already under a fertility clinic, and the NHS actually don't normally investigate until a woman has had a third miscarriage, because that's then considered to be that there's something wrong. But my consultant was amazing, and she just said to me, why on earth would we wait for you to have a third? And yeah, they identified that I had this sticky blood. So from that point, I was placed on blood thinners.
For this episode, we're joined by Dr. Viki Male, who is a senior lecturer in Reproductive Immunology at Imperial College London. I was curious to ask Viki why the NHS waits for 3 miscarriages before investigating.
So it's really important to start by saying that miscarriage is much more common than a lot of people realise, or at least than a lot of people realise before they start trying to conceive themselves. And our best estimate is that just over 15% of pregnancies will end in a miscarriage, and about a quarter of women will have a miscarriage at some time in their lives. So it's really common. And miscarriage happens most often because there's something wrong with the pregnancy, but that doesn't necessarily mean that there's anything wrong with you, or that it would happen again. And in fact, more than 70% of people who've had 2 miscarriages will go on to have a successful next pregnancy. So the majority of people who've had 2 miscarriages don't need to be investigated because they've just been unlucky twice. And that's really the rationale behind our current policy, where you don't get a referral until 3 miscarriages. But of course, there is a downside to this policy, which is that if you are one of those people who does have an underlying problem, you won't find out about that until you've become pregnant again and miscarried again.
So you kind of had the double issues there.
Yeah.
With the PCOS and the factor VIII, and later found out you had the, could you repeat that name, please?
Ulcerative colitis.
Yes.
Yeah.
And does that both affect you becoming pregnant and keeping the pregnancy?
Yes, it's both with the ulcerative colitis,
Okay.
yeah.
Nicole talks about her ulcerative colitis, which is a type of inflammatory bowel disease. I asked Viki how this can be linked to fertility challenges.
Well-managed inflammatory bowel disease doesn't seem to affect fertility or the chance of miscarriage, but there is some evidence that if you have active disease like a flare-up, that increases the risk that you'll have pregnancy complications like a miscarriage or even a preterm delivery. And there's also some evidence actually that if you conceive at a time when your disease is active, it's harder to get in control later on in the pregnancy. And that's why the goal for anyone who has inflammatory bowel disease would be to try and get into remission, well managed with medication, and to be in remission for at least 3 to 6 months before trying to conceive.
You received a lot of diagnoses there. So how did this make you feel?
When I was diagnosed with PCOS, I mean, obviously I'd rather have not had something that was going to affect my future fertility, but at the age of 19, it just wasn't on my radar so much. And so it wasn't a huge deal to me. But then as I met my partner and was in a position to actually want to have a baby, it was definitely inconvenient, to say the least. And I was very lucky that my GP referred me straight to a fertility clinic. And there are actually medicines that can cause you to ovulate. So from taking that medicine, I was able to ovulate regularly, and eventually I did conceive. When I met my partner, who I knew I was going to be with long term, I actually encouraged him for us to start trying for a baby earlier than we both perhaps wanted to, because I knew it wouldn't be a straightforward journey. With the factor A, I was just so gutted that I'd lost 2 babies to this, when a blood test a year or so, a year and a half before, could have prevented that. And yeah, again, the ulcerative colitis. I mean, I should caveat all this by saying I've had very bad luck. So if there's anybody listening who's trying for a baby, don't think that this is going to happen to you. I was sort of very unlucky to have this kind of cocktail of conditions that affected me. But yeah, the colitis, it was just sort of frustrating to have another thing added to the mix every time I thought I had sort of found the solution and had a better chance, then something else came along. And with chronic conditions like colitis, it's quite hard you have to try multiple medicines often to actually find one that works well for you.
PCOS will tend to first manifest itself at around the time of puberty, which makes sense because it's a hormonal imbalance in how your menstrual cycle is running and ovulation. So it makes sense that you wouldn't notice it until puberty. And with ulcerative colitis, similarly, that's a disease that kind of develops over time. Now, both of those have genetic factors that are involved. You're more likely to have them if you have a family history of them, for example. And there are certain genes that are kind of loosely associated with them. But it's really a lot more complicated than those being diseases that you're born with. They're ones that develop over time. And Nicole mentioned this idea that, her ulcerative colitis, it only developed after she had started on this journey of doing fertility treatments. And I thought that was really interesting because we do know that certain autoimmune diseases can respond to hormones. And we can imagine a situation in which, the hormonal treatments that she's taking and the pregnancies that she's going through could potentially impact her immune system in a way that might trigger something like this happening. So that's a really interesting idea that she had there.
So you told us, so with the PCOS, it affects you becoming pregnant, but then you did become pregnant, but you had quite some miscarriages. Can you tell us a bit about your miscarriages?
Yes, so the first one, so it was after trying to conceive for around a year that I did conceive. And I was over the moon. I remember the test going positive. I just couldn't believe it. I felt so strange. I was like, there's two people here now. There's a person inside me. It was a really strange feeling and really lovely. I had a really symptomless pregnancy. And when I had my 8-week appointment, I mentioned that to the midwife. And she was very good. She didn't say anything to alarm me, but she said, we want you to feel reassured, so I'm going to book you a scan. And I think what she had potentially identified is that loss of symptoms or lack of symptoms, absolutely not in every case, but it can also be a sign that something isn't quite right. And I'm saying this, I know people who have had symptomless pregnancies and everything's absolutely fine. But yeah, unfortunately, when I had that scan, the baby hadn't developed past about 7 weeks, I think. And that was obviously just completely heartbreaking, especially that first one, having been a year journey to get to that point. And you just, I didn't know, it's called a miscarriage when the baby's actually, but the fetus has not survived and it's still inside you. I didn't know that could even happen. I actually read some really interesting guidance that said miscarriages on television and in films are depicted as the woman bleeding heavily, but actually in a lot of cases that's not what happens. You don't just suddenly start bleeding, it's gradual, and in my case, not at all. So I had a small operation, which is where you're under a local anaesthetic and they actually remove the pregnancy tissue.
So this was, you were being treated for your PCOS and you became pregnant, but they didn't find a factor VIII yet.
No. And so after that, I just went back on my medicine to help me to ovulate, and I actually conceived again really quickly. So after a miscarriage, you can't try for a baby again for at least a month or two because your body needs to recover from the process. But yeah, I conceived so quickly that I felt like that had to be a good sign. But yeah, unfortunately with that pregnancy, I was very, very sick, and again suddenly it just disappeared. And that time I knew what to expect. I waited till my 8-week appointment, and it was really interesting because so many people were saying congratulations, and I was just nearly in tears knowing that something wasn't right. And yeah, they referred me for a scan and it happened again. And yeah, again, just it's really hard to, it's sort of so day to day for the staff that are dealing with you, but for you, that's your potential child. Yeah, so it was just devastating. And again, that was the point where my fertility consultant decided that to send me for the blood tests, and that was when the factor VIII was diagnosed. And then after that I had a chemical pregnancy, which is just basically where you get a positive pregnancy test which then goes negative and you have a period. So this isn't classed by the NHS as a miscarriage. But to me, it had only been a little while, but I knew I was pregnant. I then knew I wasn't. It was still pretty upsetting.
I asked Viki to explain what a chemical pregnancy is.
So for actually a lot of us, a chemical pregnancy is what we would think of as being pregnant. It's basically when you pee on the stick and you see the two lines. So your body, or actually not your body, the placenta, the baby's placenta, is making a hormone called human chorionic gonadotropin. And it makes absolutely loads of that. And it's such high quantity that you can detect it even in your urine. So a chemical pregnancy is basically when you get that second blue line on your pregnancy stick, on your test stick. But then in early pregnancy units, we have a second definition of pregnancy, which is when you can actually see something going on by doing an ultrasound. And so it can sometimes happen that you get your second blue line, but then a couple of days later, your period starts. But because you've had that second blue line, you know that you were pregnant and you're not pregnant anymore. So that's one way you can have a chemical pregnancy. And another way, particularly in IVF settings, that you might have a chemical pregnancy is you get your second blue line. But when you go to have an ultrasound scan to see how you're getting along, they don't find anything there. So basically, it's a really, really short-lived early pregnancy where we see the hormone, human chorionic gonadotropin, but actually the baby doesn't continue developing after that, and so the pregnancy ends.
And then, so by that point, I was in a pretty bad place mentally. And that was around the time that I started to develop ulcerative colitis symptoms. And they do say that colitis can be triggered by, there's a link between emotions and colitis. So maybe it's not surprising that around that time that happened, but it's called a flare-up when your symptoms are severe. And my first flare-up, which was the first I knew of having the condition, was very, very serious, and I was hospitalised for 5 weeks. And I lost a huge amount of weight. And I remember after that, even while I was going through that, my priority was having a baby. And it was almost like I could see my body sort of going to ruin, but all I cared about was my body isn't in a fit state to carry a child. And I remember my first appointment with my fertility clinic after coming out of hospital. She told me I had to get my weight up to, I think, 8 stone or something before I could start trying again. So then it was just my mission to eat everything. And then, when I saw her again a few weeks later, she let me go back on the medicine. And unfortunately, I did conceive about 6 months later. But by that point, I was classed as having recurrent miscarriages. So the hospital actually give you a scan at, I think it's either 5 weeks or 7 weeks with that. So it was my early scan. And I remember walking through the hospital feeling sick to my stomach, and it didn't occur to me that anything might be wrong. And unfortunately, with that one, they could see that my baby wasn't developing properly. So I think it was the scan was at 7 weeks, but my baby looked to be 5 weeks old. And because it was technically still alive, I had to wait a week and come back. And then when I came back and was re-scanned, then I had lost it. And at that point, so with that one, I had an operation under general anaesthetic to remove the pregnancy tissue, because I didn't mention before, but with my second one, the operation to remove the pregnancy tissue under local wasn't successful. And that's happened because your pregnancy test stays positive. And then, so I had to have that operation under general. And so this time I said to them, I think it's best to just do that straight away. To save that step. And also all I was worried about was time as well, because I just sort of thought, I'm not getting any younger, I want to. And I was just so desperate to have a baby by that point as well. And at that stage, my consultant decided that perhaps IVF was the way to go, because I think it had been 4 years and I was averaging a pregnancy a year, which isn't really enough, considering I had recurrent miscarriage as well. So then I moved on to IVF. And I did lose a couple more after that, unfortunately.
Nicole shared with us the miscarriages she had. In general, how often does a miscarriage, let's say if someone has 1 or 2, actually imply fertility issues? Should people be worried at that stage?
If you've had 1 miscarriage, then you've got an 80% chance of a successful pregnancy. And as I said, after 2 miscarriages, you've got a 70% chance of a successful pregnancy. And so most people, almost everyone who's had 1 miscarriage has been unlucky. And most people who've had 2 miscarriages have been unlucky twice. And that's why, in general, we wouldn't counsel people to get too worried after 1 or even after 2. But obviously, you do have to work out where the line is. And on average, the line is 2 for most people.
So you already introduced IVF. This decision to start with IVF, you said that started with your consultant?
Yeah, that's right. It was my fertility consultant who decided that that was the way to go. It takes quite a long time once you've been referred for IVF for things to actually get going. I think it was a matter of months, because the NHS actually have to apply for funding and they have to check that you're eligible. I had a bit of a blip because with the trust I was in, I wasn't eligible because my partner has a teenage daughter from a past relationship, and some trusts say that if either parent has a child, you're not eligible. But I was very lucky that I could move to a different GP that was about the same distance, and that took me to a trust where I was eligible.
Talking about IVF, I wondered how many babies in the UK are born through IVF. So I asked Viki.
So the statistic actually that's easiest to find is what percentage of babies in the UK are IVF babies. And that one's a nice clear one. About 2% of babies born every year in the UK are IVF babies. So that's kind of common, right? But then, of course, not everyone who has IVF, sadly, will end up with a baby. So I was trying to work out how many couples, what percentage of couples in the UK will have IVF. So in the UK, about 12 to 15% of couples don't conceive after a year of having unprotected sex. And of those couples, about half of them will conceive if they keep trying. Now, some people might go to IVF quicker than that, but we might estimate that about 6 or 7% of couples would need IVF to conceive. Some of them might decide against it, some of them might go through it and it doesn't work for them. And that's how we end up with that sort of 2% of all babies in the UK born every year are born having been conceived through IVF.
When you started IVF, how was this process and how was it affecting you mentally and physically?
So physically, it is quite challenging because you're putting a lot of different medications into your body. You start off with a cycle where they do your egg collection and actually use sperm to make your embryos. So that one is a little bit tougher on the body. You become quite sort of swollen almost. I've heard about people going through IVF who get offered a seat on the tube because they've puffed out and they look maybe pregnant. It can also make you quite sick. You can get something called overstimulation where your body produces too many eggs. And then the actual process of collecting those eggs is done under a general anaesthetic. So again, there's sort of the impact of that. But then you have your embryos if that process has gone to plan. I should say I'm aware of people where, unfortunately, they don't manage to stimulate the follicles in the ovaries to actually release eggs. And sometimes, so when you have that process, they make quite a lot of embryos, but they then have to check that they're actually viable. So you get a phone call, I think it's the day after or a couple of days after you've had your egg collection and it's been mixed with the sperm that you're using. And you'll be told something like you've got X number of embryos, but only X number are actually viable. So I think with my first one, there were 9 embryos, but only 5 were viable, or 4, something like that. I think it was 4 actually.
And then, so with these 4, so how quickly can they be placed back?
So you can either have what's called a fresh cycle, which is where you have them put one, depending on your age, they might put 2 put in straight away. Or they might do what's called a frozen cycle, where they freeze the embryos. You go through another cycle of medication, and when the lining of your uterus is at the sort of optimal point, then they would defrost the embryo and put it inside. But for me, I had a fresh cycle straight away.
Nicole explained about the number of embryos she had during her IVF cycles, and I wanted to hear from Viki what these numbers on average are for people going through IVF.
Talking to I'm not a clinician myself, but I was talking to some of my colleagues who are clinicians and work up in our fertility clinic. And I said, what's the goal? And they said 3 to 4 viable embryos is the goal for most cycles. So 4 viable embryos is exactly what puts you on track. Although it can range enormously from none to a colleague of mine said they'd seen as many as 15 one time. But 4 is definitely on track. Thinking then about what affects the number of viable embryos you're going to get. Well, you've kind of got 2 factors here. So the first is how many eggs have you managed to get? And things like your age, any medical conditions, so PCOS would be a really important example here, and lifestyle factors, those will all affect how many eggs you manage to collect. And obviously, the more eggs you manage to collect, the more chance you have the more chance you have of getting more embryos because you're putting more eggs in. But then, again, you've got the question of, okay, and how well do those eggs do at making viable embryos? And here age again plays a factor because in younger people, each egg is more likely to produce a viable embryo. But we also need to think about the other side of the equation, which is the sperm. We can get a bit fixated on the female partner's role in all of this because again, higher quality sperm is more likely to give us viable embryos, and sperm quality is also influenced by things like age, medical conditions, and lifestyle factors.
And you already slightly hinted to the fact that even after IVF, you had miscarriages.
Yeah, that's right. So my first couple of IVF cycles didn't work. And I think part of the reason for that, I mean, I was told that there's only about a sort of 1 in 3, 1 in 4 chance of it working anyway. But I think my colitis wasn't as well managed at that point as it could have been. And in the time that I was going through those, they changed me to another medication that was managing my colitis much better. So then I did conceive with my third cycle. And that one, unfortunately, it didn't work out. That was actually, that and my first miscarriage, I would say, were the hardest, because I got to my 12-week scan. So I'd been scanned twice at that point and everything was going well. At my 12-week scan, I felt pregnant. And unfortunately, it hadn't survived. And yeah, that was one that really killed me as well. And then I did conceive again through IVF on the following cycle, but unfortunately that pregnancy was ectopic. That's where the embryo actually implants within the fallopian tube. It's more common. There were a few factors that made it more common. So for me, I was in my 30s at that point, and I think that does increase the risk. But also, when you're having IVF, it's more common to have an ectopic pregnancy. And it was interesting because I knew I started having bleeding, and I phoned the hospital and they said, this is just implantation bleeding. And I was like, okay. And then I had a lot of pain, which was sort of getting worse. And I was scanned at the hospital, but they said it's too early, we can't see anything. And then that was on a Friday, and then over the weekend I started bleeding heavily. And ectopics are quite dangerous, so you will be hospitalised fairly quickly if you have heavy bleeding with an ectopic or a lot of severe pain. And yeah, on the Monday I was scanned again and they could see that it was ectopic.
And then what happened?
So for an ectopic pregnancy, I was given 2 options and one was recommended to me. So I think for some people it can be necessary for the fallopian tube where the embryo has implanted to actually be removed. Sometimes, depending on how much growth there's been, there could be damage to the tube that's irreparable. In my case, I could be treated chemically with something called methotrexate, which broke down the pregnancy tissue.
So you talked how it affected you physically. You already slightly hinted on it, but how is it mentally to go through all of this through the IVF and the miscarriages?
So the only way I can explain it is it just sort of takes over your life. It becomes a weight that you carry around with you, a kind of a burden of sadness that you're sort of, everything you do is kind of tainted with it. You can, I mean, I say this is how I experienced it. I almost felt like I became obsessed. And when I was going through an IVF cycle, I was much better mentally because there was a glimmer of hope. The thing that was hard for me was the aftermath of a miscarriage, or that kind of waiting period where I couldn't start trying again. And I just had this kind of feeling of helplessness that, what if this never happens for me? And I had to really, it took a few years, but I sort of had to get my head around the idea that this might not work out. I mean, obviously IVF, I was with a trust where I had 2 cycles on the NHS. Some trusts only give 1, some give 3. There was a point where funds were going to run out as well. There were a lot of sort of things that go around in your head, and you also, life doesn't really let you forget that you're going through something like this. Everywhere you look, there are pregnant people, there are people with children, and you get a little bit resentful, or I did. I just sort of was thinking, why is it so easy for everyone else but not for me? Which of course isn't right. It's challenging for a lot of people. It's just you can feel quite alone. So mentally, the 2-week wait once you have had the embryo placed inside you to find out whether you're pregnant, it's quite difficult, but also I found it in a way positive that I had this glimmer of hope. And they say that you shouldn't do the pregnancy test until those 2 weeks are up. They give you a date when you should do a pregnancy test. But I mean, for myself, I wasn't very good at waiting. I was doing the tests from about day 3, just because I couldn't not. But that can be dangerous on a fresh cycle, because the hormone that you're given in the treatment will sometimes give a false positive. So that's something to watch out for. That actually did happen to me briefly, and then it went negative. But yeah, it is mentally challenging when you're sort of going through that 2-week wait, and you really want to make sure that you're sort of not doing anything that could affect that embryo possibly implanting. So it's always on your mind.
I think this is partly why we have this discussion, to make it clear that you're not alone.
Yeah.
There's others out there, because, I mean, I know you for quite a while and you're really open about it. So we'll come back to that. But I think it's really helpful for people to know what people are going through and be able to help you. Let me just first ask, because you say, like, you saw other people with kids, but did you also know other people who were going through IVF?
So I didn't actually, but I knew of people. And yeah, as you say, you don't tend to tell people. And I find that if sometimes you do mention it and people don't really know what to say, and that they'll just be like, oh, okay. And then they kind of brush past it. And then I would get a feeling of, oh, should I not have said that? Have I made them uncomfortable? But I mean, it can't hurt for people to be aware that these things happen. As you say, people don't talk about it, and probably could get a lot of support from meeting other people. And yeah.
When did you start telling people you were having fertility challenges, and who did you tell?
So at first, I didn't really mention it to anyone. And even when I was going through my miscarriages, my coping mechanism is to just keep going. So after my first operation to remove my miscarriage, I went into work, which wasn't wise, but...
How many days did you take off in between?
No, I actually went from the hospital to work. I mean, honestly, it was all I was so broken. I just was like, if I throw myself into something else, obviously not the best way to deal with it, I imagine. And I remember sitting there, like, having had this operation and feeling really sad, and I just sort of thought, and everyone else is just carrying on, and should I tell someone what I've just been through? And I just didn't, because I didn't want to make people uncomfortable, and also everyone would have said go home, and I just sitting at home on my own, thinking about everything wouldn't have been right for me. With the first few, I didn't mention to anyone, and then it became such a big part of my life that I found I naturally just started sharing more and more. With the IVF, again, I just became it became more normal to me as well. At first it was quite new, but then it just, I just found it sort of coming out more and more.
Yeah. And
I didn't mention to my family, although I did, when I was hospitalised with colitis, I did tell my parents that I felt like this was probably one of the causes. But a thing for me is that you're going through so much grief yourself, you don't want to deal with anyone else's grief. And so people that were emotionally invested, for example, my parents, that was their potential grandchild, I just couldn't deal with telling them. But that's not to say they wouldn't have been brilliant and given the right reaction. It was just sort of how I felt.
In a way, it was too much for you to actually get them involved. The first people you told, were there people who were more distant to you? Was that useful?
So yeah, my best friends I told afterwards. I hadn't told them at the time that we were trying, but I told them once things had sort of started to go a little bit wrong. And sort of less close people, like work colleagues, I ended up telling a bit later again. One thing I discovered is that once people know you're trying to conceive, they look out for signs that you're pregnant. And so I remember once I was at the pub and I had one wine, and it was nothing to do with pregnancy, trying to conceive. I just only wanted one wine that day. But a lady who knew sort of gave me a knowing smile and went, one wine, eh? And it's really hard to have stuff like that happen when you're sort of going through fertility challenges, because obviously you wish you were having one wine. Well, I wouldn't have had any, but you wish you were pregnant, basically.
How did you feel the medical teams were helping you, or were they actually helping you, or what could have done to make you feel more supported?
So with the fertility treatment and the IVF, the teams that were supporting me were absolutely incredible. They just, I can't fault them. They were so supportive, I guess because they do it on a daily basis. They were very sympathetic to the challenges that women go through. But I found other medical professionals weren't as supportive. So with the first miscarriage, the sonographer was amazing, and she was obviously very compassionate and said all the right things. But a doctor had to come in to scan me again to confirm that the pregnancy hadn't survived. And that doctor barely looked at me. And when she scanned me, she didn't interact with me. She just sort of nodded to the sonographer and said, yes, I can confirm. And then she turned to me and said, do you want to see? That was the only words that she said to me. And I just thought it would have been so easy for her to just add in a little, I'm really sorry for your loss, or just something. It just made a difficult situation even harder. When you've just miscarried, they put you in a kind of side room, and my partner and I were just in floods of tears. And the midwife came in and just went, oh, have we had some bad news? And the look on her face, she didn't care. It was day to day for her. And it really impacted me, just knowing that she didn't really care. And also to say, have we had bad news? She knew. She knew why we were crying. It just, yeah. And you're in such a vulnerable emotional state that something like that can really affect you. And then I also had to go back to that. So with my first and second miscarriage, I changed hospital after that because I was so unimpressed with how it was dealt with. But basically miscarriage patients are dealt with in the same space as pregnancy in the antenatal unit. So I was going to have scans to confirm I'd miscarried, and I would be in a waiting room full of happy couples waiting for a baby scan. And it was just awful. I'd just be sat there crying. So things like that, I think hospitals should definitely do more. And when I moved to a different hospital in the same trust and found them to be much better, they actually had a special unit for baby scans for people who either had recurrent miscarriage or thought something might have gone wrong.
Hearing Nicole talk about her experiences made me talk to Viki as well to hear what the normal procedures are in hospitals.
I'm really sorry to hear that was her experience. And I know a lot of hospitals, including mine, do try to have a separate early pregnancy unit for exactly that reason. And also do try to have separate provision for people further along in their pregnancies who are giving birth in dreadful and difficult circumstances, so they don't have to be mixed in with the people who are giving birth in much happier circumstances where they're, meeting and taking home their new baby.
Were you ever offered any counselling for this?
So when you miscarry, you're given a leaflet, and it has phone numbers for helplines. And I, in retrospect, should have engaged more with that. But also, with the IVF, on the NHS, you get one counselling session. Another thing that I felt they maybe should have been a bit more aware of is that when someone is pregnant, it's not necessarily a big congratulations moment. When you have recurrent miscarriage, you want to be happy that you're pregnant, and of course you are, but you also are terrified. And I used to ask to not be told my due date. So I found with my first pregnancy where I did know my due date, and when that date came around, I'd obviously lost the pregnancy. It was very upsetting, and it really hung over me, the sort of run up to that due date, when in my head that was when I should have been having a baby. So for subsequent pregnancies, I asked them to not tell me my due date. Obviously I knew it approximately, but I just didn't want that date hanging over me. So it's just being aware that if someone has recurrent miscarriage, being pregnant is quite a scary time as well. I was twice told to enjoy the pregnancy, which I thought I'd love to, but...
So we talked about how the medical profession might be able to support you and others going through the same. But what about people around you? How do you feel that others could support you with things they say or maybe shouldn't say?
So I think it's just really important to be there for somebody who's going through this. Be very aware that there isn't a kind of one size fits all for what's the best thing to say. Something that people would say to me that I found sort of reassuring was at first was, now you know you can conceive, hopefully it'll happen again. Another friend told me that she really didn't like people saying that to her when she'd lost a pregnancy. So, I mean, it's almost best to err on the side of caution and just sort of say, how can I support you? Do you want to talk? Things like that. One thing that people have a tendency to do is suggest reasons that things might not be going so well. For example, is your work too intense? Should you be taking this particular medicine? My friend took it when they were pregnant. It's not a good idea. You're not a doctor. The reasons for miscarriage are complex, but also sometimes a lot of the time I think it's just a genetic thing. The fetus wouldn't have made it. There's also a lot of guilt associated. But this is what I experienced with miscarriage. I had a baby inside me. I was its mum. I was there to protect it, and it hadn't survived. I felt guilty about that. So with other people saying, could you have done this differently? What I was hearing is, you did this to yourself. And it's just not helpful. So I would say avoid anything like that. Really don't lose sight as well of the fact that this is a loss of life. This is somebody's baby. Even though medically it's not counted as a baby yet, so I think it's a fetus until a certain point. This is their baby. So I had people say things like, think of all the other things that are going well in your life. And I just thought, would you say that if someone had lost a family member, a parent, a grandparent? For me, this was my baby, and thinking of other things in my life that are good isn't going to bring back my baby. Yeah, I think it is hard for people because obviously that wasn't a person that you could see. Maybe they accidentally say things like that, but really, really remember that to the person who's lost that had that miscarriage, they've lost a baby. But also, if you're pregnant, if you have children, don't lose sight of the fact that there could be people around you who are going through something like this. Twice when I was going through miscarriages, I had people that I didn't even know, just work colleagues that were in different departments, for absolutely no reason, tell me that they had baby brain. I just felt so angry. I thought I didn't need to know that. And, now I feel rubbish again. Equally, sending baby scans to group chats. A lot of people think that's okay. I should kind of emphasise, it's not that I'm not happy for people who are having babies, who have kids. It's just that by that point of having gone through so many miscarriages and been trying for so long, I just felt more sad for myself.
Well, and you should. And I think what we discussed before, because a lot of people don't talk about it, people forget that some people can go to these fertility challenges. But like you said, 1 in 10 people have PCOS. Yeah. So who knows how many people actually are trying without succeeding to the level they like. So thank you for sharing all the things that were not nice for you to hear. Are there things that would be good for people to do or say?
Just checking in, really. I mean, so actually one of the leaflets I read, it said some people go one way and they just want to talk about it a lot and that's their way of coping. Other people go the other way and don't. So, I mean, a simple question, really, of do you want to talk about it? Do you want me to ask you how you're doing, or would you rather not speak about it? I think can really help you to do what's best for that person. And I remembered sort of when I was thinking about all this, when I lost my second one, my best friend just sent me this massive bag of pick and mix from this website that does pick and mix. And it was like the best thing ever. It just really... it picked me up. So like something like that, she didn't write a message, nothing. She just sent me a giant bag of pick and mix. Maybe take someone out to take their mind off things. And just if you have a friend going through this and you have kids, don't talk about your kids. And it's hard because obviously they're a huge part of your life. Just try not to, or don't talk about having been pregnant. Unfortunately, when I was going through this, my best friend had 2 babies and we were best friends, but I reached a point where I just struggled to stay in touch with her because it was just so painful, to be around pregnancy.
So what kind of things in your life while you were going through your treatments did you find triggering?
So there's obviously the fact that people around you are pregnant, have children. I used to find seeing a baby on board badge on the tube challenging. I reached a point where I would change carriages because I just was doing so much to try and keep myself away from these things that were triggering for me. Things like adverts relating to pregnancy on TV, even on the tube, and pregnancy in films and TV. Until you go through something like this, you don't notice just how many pregnancies or pregnancy-themed storylines there are in films and TV, and the amount of series or films that my partner and I had to abandon because suddenly a character was pregnant and I was just like, nope, I cannot watch this. And actually talking to people about that made me realise just how many triggers there are for everyone, because I complained to my friend who had breast cancer. I mentioned to her about pregnancies in films and TV, and she said, think how many cancer storylines you get as well. And so I guess there's always something for someone.
Very true. What about work? How did this challenging period in your life interfere with work?
So you have a lot of medical appointments with kind of miscarriages, but also with IVF. With IVF, you have scans. It can be up to every other day because they need to see sort of how things are developing and when you'll be ready to have the embryo implanted. So, yeah, I think workplaces, it's just them being understanding, maybe letting people work from home.
Thank you so much for sharing your story. And it must be so hard, like, going through all this. But was there something positive that came out of your diagnosis or that changed for you having gone through this?
So, yeah, going through something like this, it just kind of increases your awareness of the fact that people might be going through things that they're not telling you about. And if, in the workplace, for example, if somebody suddenly doesn't seem to be doing as much as they were before, or just that kind of awareness that there are medical things that could be impacting people that they're not sharing.
What advice would you give to someone who is thinking about trying for a baby or going through similar things you were going through?
So somebody thinking about trying for a baby, I mean, purely based on my experience, I wish that I'd had those blood tests. I'd just gone private and had those blood tests, which I appreciate isn't an option for everyone for various reasons. But if I'd known that my blood was sticky and I'd had that test, I think if I was a bit younger, they would have waited for me to have a third miscarriage before they would have even done those blood tests, just so you know if there's anything there. And I guess as well, people going through miscarriages, I would just say, do seek support. I never phoned those numbers for the helpline. I probably should have done, looking back.
So in general, what do you think can change in society to support people who have reproductive challenges better?
I think a general awareness of the fact that this is happening and how painful it is. I think the NHS, it becomes quite day-to-day because miscarriages are common. I mean, I know there is a lot of research into this, but reviewing practices at every trust, thinking about, are we putting people going through miscarriages in a position where they're around pregnant people? Anything that can be done to avoid that. One thing I noticed was that people would ask me how I was in hospitals, and my partner would just sit there as though he wasn't there. Occasionally he'd get an I'm sorry from someone, but in all of this, so multiple losses, there was only one midwife that actually looked at him and said, how are you doing with all of this? This must be hard for you too. So I think that was something that should change as well, just to think about. I mean, the focus is always on the woman experiencing the miscarriage, but just to remember that it's a loss for the partner as well.
So we talked a lot about what has happened to you in the past. So how is it going now?
So I was very, very lucky. My 5th round of IVF worked out and I actually had a baby boy last year. So it still doesn't feel real. It was amazing. I'm just incredibly lucky.
I'm very happy to hear that. So how does it feel to have him now and looking back on the history?
So you don't ever forget what you went through, and I do still think about the ones that I lost. Something that I've heard other people who had recurrent miscarriage say is, well, who went on to have children, is that it wouldn't be these ones. And so I do look at my son and think, if my other pregnancies worked out, it wouldn't have been you wouldn't be here. But yeah, you don't forget about it. And I found I was became a big part of my life, and it's something that I would talk about quite a lot. But once you've had a baby, people sort of just say, well, you've got a baby now, but you don't forget. You don't. It's something that was traumatic to go through, and it does stay with you.
Thank you so much, Nicole. I hope with your story we can open up a bit the discussion and for people to realize what others might be going through. And thank you so much for sharing all this, your personal story and all your insights.
Thank you for having me.
Dare to Discuss was presented by Linda van Kempemer. It was recorded and edited by Vaiva Damanita and Naomi Whitmore. Thank you for listening.